بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه وسلم أجمعين. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا يا كريم. Dear colleagues, this is one of the basic lectures that has not been delivered in English before, and I intend from this lecture to provide some of the most basic knowledge about how MRI machine is working. And this is not a real physical principle of MRI, but it is just a simplified way to understand what is meant by T1, T2, what is the pulse sequence, and how can MRI produce images. And actually you see now the first MRI machine that has been developed for human imaging. You can see how big is the magnet, and the patient is sitting inside of the magnet undressed with something is put around his body, and this is known as the surface coil. The surface coil is just like the probe of ultrasound. We put it closer to the part to be examined in order to obtain clear images. And on this side you can see the first MRI image of the human body, and it is easy to see that it is for the chest. You can see the heart, you can see the lungs, and you can see the ribs as well as the spine. After that, many developments have been done in the field of magnetic imaging, and until we reached this very beautiful, clean machine. The patient is lying on his back in quiet rest. The oxygen is adjusted by a computer, and also you obtain very clear imaging of the body. And we have about 5 MRI machines. The first one is the closed MRI, where the MR is in the form of a tunnel. It's only open at the patient head and the patient feet, and this is the appearance of the tunnel itself. At that time, the patient totally was enclosed within the magnet, and this had resulted in many drawbacks, especially for those who are claustrophobic and they are afraid from the closed spaces. Then they made some changes in the magnet to allow the patient head free and also the patient feet, but this did not add too much to the acceptance of the magnet. And at that time the open MRI has been introduced to the clinical practice. In the open MRI you got a lot of space around the patient, and there is no more claustrophobia, and this is usually presented to ensure the patient that there is no fear of a tight magnet and the space is too large around the patient. Then we have the third MRI machine, which is known as the extremity magnet, and this can fit for examination of the upper limb, including the elbow and the wrist joints, as well as the lower limb, including the knee and ankle joints. Then we have the dynamic MRI, which can image the patient while he is standing, or in the standing position, or in the weight bearing position. This is very important in imaging of the spine and joints that are subjected to weight, like the hip the knee, and the ankle. Then if you look carefully for this MRI of the back of one of the patients who did a surgery for L45 disc. This is a recumbent MRI where you can see that the operation is done very good and there is no complications at all. But whenever you have the image while the patient is upright, in the upright position, in the weight bearing position, and you can see that there is significant instability at L3-4 disc level, and you can see marked narrowing of the spinal canal, and this is the source of the patient complaint. Now we have the fifth machine, which is known as the stress test MRI. And
most patients experience back or neck pain while sitting or standing and lie down to relieve their pain. Traditional MRIs examine patients while lying down in the position least likely to show the source of their pain. At Spine Nevada, we use a stress test MRI to examine the spine in both supine, lying down, and while bearing weight, sitting or standing. This allows doctors to observe how a patient's body weight applies pressure to the injured discs, pinching the nerves and causing pain. The unique Esaote tiltable MRI obtains images in both the traditional horizontal position and tilts to an upright position during the same examination. The stress test MRI explains why patients hurt standing up but feel relief laying down, and why conventional MRI exams may fail to relieve the problem. The stress test MRI used to examine the lumbar spine visualizes the anatomy in both supine and weight-bearing positions, and shows increased pressure applied to the spine while standing. Stresses on the discs are minimal when a patient is lying down during traditional supine MRI examination, and may only show a slight disc bulge or nothing at all and no pain. When the table is tilted vertically, body weight compresses the disc, causing the central disc material to protrude or herniate, pinching the nerve root and producing pain. Supine images frequently fail to document disc herniation or nerve root compression, while MRIs taken in weight-bearing show the source of the patient's pain. A stress test MRI helps doctors at Spine Nevada diagnose and understand positional symptoms, which often affect the patient only when sitting or standing. While patients may experience relief while lying down, pain, numbness, or weakness typically increase as the patient moves into an upright or weight-bearing position. Diagnostic weight-bearing images can reveal pinched nerves or injured discs that explain a patient's symptoms, and which may not be seen in traditional supine images. In fact, conventional supine MRIs can miss 30% of spinal injuries. If you experience more pain or numbness when you are standing or sitting, insist on a stress test MRI today. It's your MRI. Don't take it lying down.
Okay, you have now an idea about the stress test MRI, and as she said, you may miss about 30% of spinal lesions while having the MRI in the supine position, and this explains the fact that many patients are complaining too much of their spine, but whenever they have MRI in the supine position, you can find little abnormalities or even normal findings. Then you have to scan the patient in the upright position to see the real abnormality. Then this machine was only fit for spinal imaging, but now it is not just for MRI. It can examine the brain, the chest, the knee, the ankle, and so many parts of the body. In the beginning of MRI days, they always said that MRI has too many advantages, including the superior soft tissue contrast, the multiplanar imaging, absence of artifacts from bone, which is a major problem, was a major problem with CT machines, and is able to characterize tissues based on the signal, as I will explain. Then in order to have an MR examination of any part of the body, you should have the surface coil. And the surface coil, which is good, should be closer to the part to be examined and should not move with respiration. And this is an example for the chest coil, where the upper part of the coil is a little bit away from the chest wall in order not to move with respiration. And this is the breast surface coil. The patient lies in the prone position, that each breast is put in one of these holes, and then the surface coil is very near to the breast and is also will not move with respiration. This is the surface coil of the spine, where you can see some of that it is the patient lies in the supine position. The surface coil is very close to his back and it will not move with respiration. This is the body coil, and here is an example for extremity coils like the knee, the ankle, and also some of these coils can fit for some of the joints together. And I mean that you can use this surface coil for example to examine the ankle or to examine the wrist or the elbow, but actually it's better to have the dedicated surface coil for each part in the body if it is available. Then some contraindications were present at the beginning era of MRI, and this included the cardiac pacemaker and the intracranial aneurysmal clips. And you know, for treatment of intracranial aneurysm, you just put a metallic clip on the neck of the aneurysm and you leave it, then the blood will clot inside the aneurysm and you got what looks like simple management of the aneurysm. Then these things were made of metallic objects, and they are disturbed if the patient entered the MRI room. But nowadays pacemakers and aneurysmal clips and most of the valves and the stent are made of non-ferromagnetic material that will not react with the magnet. But still there are some of the objects that if the patient has one of them, then he should not enter the MRI room, like a metallic object in the eye, a metallic object or shrapnel near the spinal cord, some types of cochlear implants, insulin pumps, and some of the neurostimulators. Then what happens if the patient had a metallic object that is not compatible with MRI? It will produce too much artifact that will mask a good part of the image. And you can see here, this is very small metallic object will create such an artifact. But most of the recent MRI machine have the software that can remove the artifacts, and this is an example. You can see a patient with previous disc operation in the cervical spine. Too many artifacts has resulted from the disc cage and obscured the region of the spinal cord. Then after you use this artifact-free technique, then you can remove the artifact and you can see the changes in the spinal cord, as you see here. And this is also another example of a disc in the cervical spine with too much artifact, but using the artifact-free software, you can remove the artifacts and you can see clearly the region of the spinal cord opposite the disc. Then you know that this is a very powerful magnet, and any metallic object came near to the MR magnet, it will be pulled in a very fast way, so that it may destroy some parts of the magnet. And these accidents happen too many in the beginning era of MRI until the magnet is shielded internally. And many of these objects, as you can see here, this is one of the beds that has been pulled up from the ground and hit the MRI machine, and this was known as the missile effect of MRI. Then how the MRI will produce the image. You know that this is a very simple physical principle that if the image will result from interaction between the magnet in the machine and the magnet inside the human body. Then where is the magnet inside the human body? You know that any charged particle that moves will create a small magnetic field around. Then if you look to the atom of any component in the human body, you will see the nucleus containing some protons and neutrons, and you'll see also the electrons running around. The electrons have a negative charge and they move, they create a magnetic field. The protons have a positive charge, they move, they create a magnetic field. Then the neutrons will not create a magnetic field because they have no charge. Then a lot of electrons and a lot of protons are present in the human body. Then they create magnetic fields everywhere. But if you know that the MRI machine cannot deal with these too many magnets, it can deal only with one type of the protons or electrons. Before that, I would like to mention that the strength of the magnetic field created by the moving object is proportionally proportionate to the mass of the moving object. Then if you see that the electron has a little mass compared to the mass of the proton, then you can ignore the magnetic field resulting from the electron. Then you are dealing with the magnetic field resulting from the proton, and you would like to select the proton which is present in large amounts in the human body, since the MRI machine cannot deal except with a single type of protons. And if you consider that each proton will contribute to a point in the image, then you will select the most prevalent proton at all in the human body, which is hydrogen. You know that about 75 to 80% of the human body is made of hydrogen protons, is made of water. Then water will have 2 hydrogen protons and 1 oxygen proton. Then you know that hydrogen is the most prevalent proton in the human body, and all MRI machines dealing with human imaging also they can only deal with the hydrogen proton. Then what happens if you put a small magnet in the field of a large powerful magnet? Then you know that the small magnet will have the direction of the large magnet. Then at that time you can see the small magnet will have the direction of the large magnet. Let us say that the direction of the MRI machine is from below up, and all the protons, the electrons, and present in the human body will be arranged in the direction of the magnet. But we are concerned only with the hydrogen protons and the rest of the protons and electrons are not included in our calculation. Then, in order to have the image, the protons are arranged in the direction of the magnet. Then we have what's known as a radio frequency coil. The radio frequency coil is just an apparatus that can produce the frequency, radio frequency, corresponding to the frequency of hydrogen protons. Then, what do we mean by the frequency of hydrogen protons? You know that everything in nature, whether it is solid or liquid or gas, should have a frequency of vibration. Then if you know this frequency of vibration, you can deal with this object without touching it. And there is a very nice example. If you have a small portable radio, and you are turning the button of the radio in order to hear London broadcast, for example, then whenever you move the button of the radio, then you will hear the London broadcast. He says that I am now broadcasting on a wave with a frequency so and so. If you look to your radio, you will see the number mentioned by them at the level of your pointer. Then that's to say, if you are able to align the frequency of your small machine with the frequency of broadcasting in London, then you got the sound of London broadcast. And this is known as, in physics, this is resonance. If you align the frequencies together, this, and you hear a sound, and this is resonance. Now, if you have the radio frequency coil, which is able to produce radio frequency compatible with the radio frequency compatible with the frequency of vibration of the hydrogen atoms, then you expect whenever you push the button of this radio frequency coil, then the hydrogen will move. And this is also known as resonance. Either you get sound or you get motion. Then if you look carefully now, you will see that the hydrogen is not moving in the same velocity. You see some hydrogen is moving fast, while other hydrogen is moving slow, very slow. Then also you notice that there is some of the hydrogen atoms do not move at all. Then what happens if you shut down this radio frequency coil? The hydrogen atoms will come back to the original situation. And if the hydrogen atoms are pushed away to move against the power of the magnetic field, they acquire energy. And if you let them back, they release energy. Then you open your camera to image the outcoming energy to form the image. I will show it to you now. We applied the radio frequency, then the hydrogen has moved, and now we will put off the radio frequency coil, and we will open the camera, which will image the hydrogen protons while they are coming back. Then look at it once more. The camera is represented here by this white band. Then if you look carefully once more, and you see different motions of the hydrogen, and this is expected because hydrogen is present in different tissues. The hydrogen in the muscle moves differently from the hydrogen in the brain, from the hydrogen in the liver, and so on. Then every hydrogen proton you have imaged will appear as a bright spot in the image. Look it once more. You see here that we have imaged only these hydrogen atoms which will appear bright. Then what about the hydrogen which is not moving? It will appear black. And what about the hydrogen which is very slow and came after I shut down the camera? It will appear black. And what about this hydrogen in red? They are very fast and you cannot image by the this way. Okay, and you have now one hydrogen type that has been imaged and 3 types that are not imaged. The non-mobile hydrogen, the hydrogen which is very fast, and the hydrogen which is slow. Then in order to differentiate the black appearance of these hydrogen from this, then we will increase the imaging time, and this is represented by the broad white band. Then if you look carefully and you see these will not change, and this also will not change, they are very fast, and this one also will not change. Those who have changed are these hydrogen protons. In the previous image they are black and now they are white, and this is water. If you call the previous image is the T1 image because of the short time, then you call this image is a T2 weighted image, then you have water which is black in the T1 and bright in the T2 weighted image. Then in order to have an image by MRI, you should have an adequate amount of hydrogen in the tissues, and this hydrogen should be mobile. Then the resultant image will be on the gray scale. You will have some objects, some structures will appear black, others will appear gray, others will appear bright. Then in order to explain this in the report, the black issues are called low signal, the white issues are high signal, the gray structures are called intermediate signal. And also you may say for this hypo intense, hyper intense, iso intense, and also you may call dark, bright, and gray. But the usual wording in MRI reports is low signal, high signal, and intermediate signal. Then you have 2 images, T1 and T2, and you have 2 colors, black and white, and there are 4 possibilities. Either the lesion or the structure is low in both images, is high in both images, high in the T1, low in the T2, or low in the T1 and high in the T2, and this is water. Then what are the structures that appear black in the T1 and T2? These are which contain non-mobile protons. Where non-mobile protons are present? In the cortex of the bone, in the mature fibrous tissue like tendons, like ligaments, and in the calcification, whether it is physiologic or pathologic. All these structures will appear black in the T1 and also black in the T2 because they do not contain mobile protons. Then what will appear low signal in the T1 and high signal in the T2? This is fluid, and the fluid like CSF, for example, like vitreous in the eyeball, like effusion anywhere, like ascites, like urine. Any structure contains the fluid like component, then it will appear low in the T1 and high in the T2. The opposite of fluid is fat, and fat will show some high signal in the T1 and low signal in the T2. Fat is present subcutaneously, is also present in the bone marrow, and is present in many lesions like lipoma, dermoid cyst, and so on. Then what is the structure that will appear bright in both images? And this is blood. and blood in this particular stage, which is the subacute stage, where you can see a high signal here and also high signal here, and this is T1 because the CSF is black, and this is T2 because the CSF is bright. Then if you look to the spine, and you know that the intervertebral disc contains water if it is normal, then you see black in the T1, the CSF is black also, and the bright in the T2, the CSF is bright. But if you look to this disc, which is between L5 and S1 vertebrae, the disc is small and the disc is black in the T2, and that's to say it has lost its water content, and this means that it has started degeneration. Also, the disc is becoming inside the spinal canal, which indicates disc bulge or herniation. Then if you would like to have an MRI image, you should have hydrogen, adequate amount of hydrogen, and the hydrogen should be mobile. If the hydrogen is not mobile, then you will got no image. If there is little hydrogen, like the hydrogen present in air, the hydrogen present in air is very minimal, and we cannot obtain a signal from hydrogen in air. And the best example for this is the lung. The lung on MRI cannot be imaged by the regular ways, and you know there are several limitations for MRI imaging of the lung in particular, but it has good advantages in imaging of the mediastinum, the chest wall, and other parts except the lung, which contains air. Then what about these hydrogen protons, which are running very fast compared to the imaging? If you have the T1, they run very fast. If you have the T2, they run very fast, and these are the hydrogen present in the blood vessels. Flowing blood inside the vessels will appear black in the T1 and black in the T2. You know, if you want to have a CT image for the blood vessels, you should inject contrast material in order to see the blood vessels. But in MRI, you can see the blood vessels without any injection of contrast material, and this is a very big advantage of MRI over the CT whenever you want to see the vessels, because many times the patient had renal problems, you cannot inject contrast material. The patient may have hypersensitivity to contrast material, you cannot also inject the contrast material, but you can see the blood vessels in MRI, and you don't bother yourself whether they are black or they are white, no matter, but you can see the blood vessel, and you can also see any abnormality. Then let us collect the structures that can appear black on both T1 and T2 weighted image. You remember the cortical bone, mature fibrous tissue, ligaments and tendons, and calcification. And we can add air because of the absence of adequate hydrogen, and we can add the flowing blood because the protons are running very fast compared to the speed of imaging. Then someone says that what is the problem with blood? It is because it flows very fast. Then we will introduce a new technique which is known as the flash technique, and then we stimulate the hydrogen protons rapidly, and we shut down the radio frequency rapidly, and we collect the image very rapidly. And at that time you will not see anything in the image except vessels, and at that time the vessels will be bright, and this is known as MR angiography. MR angiography, you do not need to inject contrast material, you just depend on the flow, and these are known as also the flow sensitive techniques. So you can see the blood vessels, you can see all the moving particles in the body depending on the way how to image. Then I will give you some examples, and also you can image the veins. the dural sinuses and the internal cerebral veins, for example, and this is known as MR venography, and this is applicable anywhere in the body for the portal vein, for example, for the lower and the upper limb veins. Then bile is flowing inside the biliary system, and it has a very slow flow, and we can adjust the imaging protocol for the flow of bile. Then you got imaging of the intrahepatic biliary radicals, the common bile duct, the common pancreatic duct, and there are too many stones in the distal part of the common bile duct, and this is known as MRCP or MR pancreaticocholangiography. In this type of imaging, remember, we do not use any contrast material, and this is MRCP. You see the intrahepatic biliary radical, you see the common bile duct with the stone at its terminal part, you see the pancreatic duct, and you see the duodenum because it contains some flow of food and inside, and this is the gallbladder. Then also urine is flowing inside the urinary system, so you can image the pelvic ileal system, the ureter, and the urinary bladder, and this is known as MR urography or MRU. And remember, we do not need contrast material, we do not need to judge the renal function, because whatever the renal function, you will got these nice images. And also MRI myelography is dedicated for imaging of the CSF flow inside the spinal canal. And the difference between MR myelography and conventional myelography is that in MR myelography you cannot see the bones, you see only the CSF, and you can obtain frontal images, oblique images, and lateral images in a way which is known as MRM or MR myelography. Thank you very much. Alhamdulillahi Rabbil Alameen.